So, this video we're going to look at modification for our sidelying spiderweb. That would be this technique where we have the leg, we've met the leg, we've put our position with our leg so it supports their leg, and we start to work this external rotation with this extension in some abduction. Okay, so if this is uncomfortable for you, if they can't get their leg this high, we have modifications. So we're going to look at using a foam roller, or we have a bolster. But if we're sitting on the table propped up against their sacrum and our leg is here, the roller is going to modify or replace our leg for the modification. Okay, so we will position the roller as such. We're going to have them extend their leg back to where it can open up without the whole hip rolling to the table. We still want them in their sidelying position. Now, we've got his leg rested on the roller. It's in the same ideal position for that spiderweb technique, but now I can use my whole body as need be. So, if we need to pin the hip, I can now use my hands to bring this foot towards the floor gently to guide the hip into the external rotation. He also has the support with his thigh on the roller. Okay, you can use a soft roller, you can use a bolster. If you want to stack it a little bit higher, if they can do the abduction, that's what we want ideally. We also have the ability to use your leg propped up here. I can come from this angle and I can shift this roller so it blocks his hip from rolling any further as we want to open that leg. Okay, we have that downward pressure slightly as we press into the roller and guide the foot towards the floor. All right. So you're working to just create as much safe space and as much support with props or with your body as you can to allow them to let go into this position. Now, from this position, we can go into our sidelying spinal wave, okay, if we want to add more full body component to this. And then we can work on that spinal wave, finding the spine, peeling off the edge of the vertebrae, and then gently rolling and opening up this spine. If we need to add that pin to the hip, we have that pin, or we have that extra little guide down here as we add a little bit of pull up here to create that separation. So instead of just letting the leg hang straight off the table, which will stretch more of that lateral line, his QL, but some people might not feel like they can let go, and it might not feel comfortable. That's extreme adduction versus external rotation and extension with a little abduction. So both options are there for you. I'll show you if we just remove the roller and Mike straightens his leg so it's hanging off the table. You can see that there's a difference in the hip. It's going to change where he feels that stretch, and it also changes the joint mechanics at that hip with the femur as well. So both are good, both are beneficial. It just depends what the client needs, what you're looking to accomplish with the techniques that you're applying. So use the roller, try that, see how it feels. You can also go into the other editions of that spinal wave where we take that arm and we lift that hip just with their leg being in that abducted, externally rotated, and extended position. So, thanks for watching, guys. Try these modifications, see how they feel for you, see how they feel for your client, if they like them, if they don't, and whatever works best on your body with your mechanics is obviously going to be more imperative so that you can do this longer if you have more clients on certain days that all need these techniques. All right, guys, we'll see you in your next video.